Good afternoon and welcome to Florida Hospital's Healthy 100 live expert web chat. I'm Jennifer Roberts. We're so grateful that you joined us today. Once a month here at Florida Hospital, we pick a topic and provide a Florida Hospital expert to get your health questions answered. So we have conversations over the lunch hour. Hopefully that's convenient for you and taking a little break from work. They're no more than 30 minutes long, so we try and keep it brief. And it gives you an opportunity to learn a little bit more about a health topic you might be interested in. So today we're going to be talking about bariatric surgery and finding out if it might be right for you. So we're going to take some questions hopefully from our audience today, and that means you. This really works best when you give us some questions that we can give to our expert, who is today Sharon Kryzanowski. She is a bariatric surgery clinical care coordinator at Florida Hospital Celebration Health. She's joining us today and has a lot of expertise on bariatric surgery and getting patients kind of prepped for bariatric surgery and getting a lot of their questions answered. So I know that's something that you do very often. So now we've got all the details out of the way. Let's get some questions for Sharon. First of all, tell me a little bit about what it is you do at Celebration Health with the bariatric surgery program.
Okay. I work for the Florida Hospital Celebration, and I am the clinical coordinator, which I do patient teaching. I see people at the information session, which we hold every Wednesday to talk to the public about bariatric surgery. I visit the patients when they're in the hospital, and I try and be a liaison between the doctor's office, which is Dr. Kim's office, and the hospital, but also offer support before, during, and after surgery. I've been doing this for over 5 years, and I still have patients from 5 years ago emailing and calling or sending a card. So bariatric surgery is always up and coming and changing, so I try and keep the most up-to-date information out there for them.
Yeah, and since you have so much hands-on time with patients, I bet you get a lot of questions. You get a good idea of what people's concerns are going into something like this.
Definitely.
Yeah,
definitely.
And you've helped me out with a few questions. So I've got a top 10 list of questions that patients ask if they're considering bariatric surgery. And we're going to go through these one by one and give you an opportunity to talk a little bit about them. One of the top ones is, how long am I going to be out of work? Everybody's worried about how much time they have to take off with the surgery.
Exactly, and so are employers. So for all three surgeries, we do the gastric band, the sleeve gastrectomy, and the gastric bypass. For all three, the patients are allowed 2 weeks out of work. And they may go back after 1 week if they're feeling well. The only restriction we have is probably for our nurses here, they cannot lift more than 15 pounds for 3 weeks. So if they are a nurse that cannot go back without restriction, they would have to stay out for 3 weeks. But most times it is the 2. And we will often have patients say, oh, I took a 6-month leave of absence. Dr. Kim will not allow that because he goes around talking to companies about carrying the benefit for weight loss surgery on their insurance, and he guarantees them the patients will be back to work at a decent time. It will not be anything that will ruin the productivity at their company by them staying out for months at a time.
Interesting. So let's talk a little about, since you mentioned it, one of the other questions is about insurance. Does insurance cover the surgery? And it is becoming more common.
It is, but it actually is the employer that puts the benefit on the insurance plan to cover bariatric surgery. And you can have Aetna in 3 different companies and have bariatric surgery only covered in 1 because that employer put that benefit on the policy. So so many times I'll get a phone call and they will say, I have Blue Cross and Blue Shield, does it cover? There are so many policies, there's so many riders, we don't know until we actually check your benefits. But that is something Dr. Kim's office does for the patient and actually submits their insurance to their insurance company for approval. And there are some other doctor's offices or bariatric surgeons in the area that the patients have to submit their own insurance, and they have to check with their insurance company, and we do that for them.
So that's kind of a benefit that you do. Are you finding more and more insurance companies as you do these checks for patients? Is it increasing that more people are covered?
And especially we're in Orlando, the bigger companies, Disney does cover, and that is a huge one. And Dr. Kim does go company to company and talk with the owners and talk with people about getting that surgery covered because it is so important.
Yeah. Okay, great. Let's talk a little about, everybody know when you're considering surgery, is it going to hurt? That's a huge question for people across the board. Tell me about that. What do you tell people?
Okay. The surgery is done laparoscopically. So there are tiny little incisions, which is a benefit in pain control because you don't have a huge incision that would really hurt. There are patients that take no pain medicine at all, and then there are patients that really feel pain greatly. But I consider the pain to be like muscle pain, like you did a bunch of sit-ups and your muscles are sore. Dr. Kim has started doing robotic surgery for the gastric bypass, and that has really cut down on our pain medicine usage. And about half of the patients do not even fill their pain medicine prescription when they go home because they are not in pain.
Huh.
And I'm not promising that for everyone. Everyone's pain tolerance is different, but he and I were talking about, and he's like, ask them. Ask them how their pain is. So I started asking at their 2-week visit after surgery, and so many of them just said, I was not in pain anymore. Or I can control with Tylenol, something simple.
Yeah, okay. What about food after surgery? I mean, people are changing a lot about their bodies with bariatric surgery. What kind of things can you eat?
Okay, you can eat almost anything once your weight is off, but our main concern is that they eat very nutritious food, especially at the beginning. Okay, so let me start. No matter what surgery you have, your stomach is now a small pouch, and you cannot get in very much food, so you have to get a highly nutritious diet in because that's all you can fit in per meal.
Wow, yeah.
So it is protein like fish, meat, cheese, eggs. We love dairy. Milk and yogurt are very important in our program. Fresh fruits and fresh vegetables. So you have a variety of things that you can have, but we want to make sure that it's very nutritious food. After 6 months, we will add back brown rice and wheat pasta and whole wheat crackers and bread and things that people really, really love, but is done in moderation in the way that we tell them to do it so it does not affect their weight loss or make them gain weight. So our nutrition program is extensive. We have a 4-hour online nutrition component that the patient can do at their home with their family involved. If their family wants to watch, they can review it over and over throughout their post-op recovery, years later even. And then they come in for 2 hours with our nutritionist who goes over the program and then answers all their questions. They get a nutrition book that we call like their little Bible, that they have everything. Day 1, what you're doing. Day 2, what you're doing. Week 2, what you're doing. So there's never a question like, what am I supposed to be doing? Because we really have it lined up.
And you talked about, and I want to get an opportunity maybe even to talk about this a little bit later too, but after bariatric surgery, there is a lot of extensive follow-up that goes into that. You just talked a little bit about some of the food and the dietary restrictions and some of the things that you need to be mindful of. Are there other things that people need to consider as far as the follow-up process if they're going to be a candidate for this?
Definitely. We want the patient to come to us for life. And that is the most responsible thing to do because patients can get in trouble if they come in and have their surgery and then go on their merry way and don't follow up. We check vitamin levels, we check protein levels, nutritional status, weight, and those things are so important. So if you are a patient that's in Pennsylvania and you want to fly down to Florida for your surgery, we want to make sure you are going to come back for your follow-ups. And there are several in the first year that are so important, and then every year after that, once a year, we want to see the patients for life. So it's a very important consideration. If we have patients that live 5 hours away, if they have the gastric band, the follow-up is every 6 weeks for the first year. That might not be a doable surgery for them because they'd be driving, you know, 4 or 5 hours in for every appointment every 6 weeks. So I often talk with them about their schedule, their work schedule. Can they get off for an appointment? How far do they live? Which will make a big difference in which surgery they pick.
Yeah. I think we have a question on the web. I want to take a chance to answer that. I believe this looks like Lori, who's asking, I have diabetes and would like surgery, but my insurance doesn't cover it. What can I do?
Okay, that is such a common question. Number one, she can go to her employer and ask them, could you put the rider on for bariatric surgery? And it is an extra rider that the employer will have to purchase. But even if she took some very minimal data about how health is improved after surgery, the employer will save money in the long run because she will not have diabetes anymore. She might not have high blood pressure. All the comorbid conditions that go along with obesity are decreased or gone. So that's number one. Number two, there are self-pay procedures that the patients can pay for themselves. We offer care credit, and we have a couple other financing options that the patients can use. So that is a possibility, but mostly I would work on that employer.
Yeah, have you seen people have success with that route?
I'm not involved in insurance very much, so
Yeah.
I really don't know. I know our insurance specialists in the office would probably know that better
Yeah.
than I, but they do suggest that all the time. Talk to your employer.
Yeah, yeah, good advice. Okay. A lot of people are concerned before bariatric surgery. One of the top questions that you get from patients, what do I do with the excess skin after I lose all the weight? So we've all seen shows like, and people that have not done bariatric surgery but have had a significant weight loss have
Right.
excess skin. And how do you answer that for folks?
That has got to be the top question I hear every week. So it is all dependent, unfortunately, on genetics. We have people that have such good genes that doesn't matter their age, their skin just springs back and is beautiful. And we had a patient in the office this week, lost over 100 pounds. He had no hanging skin. You would have not guessed that he had surgery at all.
Wow.
And age. The younger the patient is, the more flexible and springy their skin is, and the more it goes back. And then the last consideration is how much you lose. If you lose 300 pounds, you will have much more hanging skin than if you lose 100 pounds with the surgery. And unfortunately, many insurance companies don't cover it. They consider it an elective procedure.
You mean the
Plastic surgery to
afterwards.
remove the skin.
Got it.
So it most times is a self-pay procedure. And it's all dependent on the person's mindset. We have a lady that stands up at support group and she wiggles her arms and she's like, these are my battle scars and I will never get rid of them. And she is just proud of where she's come. And we have other people devastated that that's the first thing they want to do. Dr. Kim will allow the patients to have the plastic surgery 12 to 18 months after their bariatric surgery, and they are waiting for that time to pass so they can go and have the procedures done. So each person's individual.
Yeah, yeah, but it's definitely something to consider, especially when you're talking about cost before you go on to
Definitely.
this venture.
But I always say, do you want all that skin filled with fat and you don't have surgery,
Yeah.
or do you want to have all that fat off because the health improvements are so great after surgery that a little hanging skin I wouldn't think would matter.
Yeah, yeah. Interesting perspective. Tell me about some of those health benefits to bariatric surgery. There's been a lot in the news lately about diabetes resolution with bariatric surgery, but I know that's not the only thing out there.
Oh, no, that's not. And we can talk about diabetes resolution because I think that's one of the main reasons people will come to us. And they will say, my doctor sent me here because I have diabetes. It's ruining my eyes. It's ruining my vessels, my heart. And with the gastric bypass, many of our patients are off their diabetic medication before they go home from surgery, so within 2 days after surgery. With the gastric sleeve, it's about 3 months it takes for the diabetes. And it's not every single time, but it is many of our patients. With the gastric band, that is the one thing that is different. The band being in and around your stomach does not do anything in the world to get rid of diabetes. It is actually the weight loss that does it. So it's about 62% of the patients that have the gastric band and lose their weight will get rid of diabetes, which is still a very good number, but it's not as high as with the gastric bypass in the sleeve.
And there's as you're explaining the different options, that's definitely another choice for people to consider.
Exactly.
And I'm sure physicians and you help kind of talk patients through that process of deciding which procedure is right for them.
And that is true. We start at information session, and Dr. Kim or I or Dr. Buffington will go over the 3 procedures that Dr. Kim does perform, and we go over risks and benefits, advantages, disadvantages, and it is very eye-opening because if you ask the patients when they walked in, what surgery do you think you would like to have? When they're walking out, they have a totally different perspective. But also then the patient is scheduled for a new patient appointment and they come in and see the health practitioner and they can actually go over the 3 surgeries. I have diabetes, would one be better for me than another? And they can have a face to talk to go over which surgery would be right for them.
Yeah, important choices to make. We have another
Very
question
important.
that's coming in from the audience, so I definitely want to respond to that. This question says, does Medicaid cover some of the costs of the surgery here in Florida? I heard of a person who got her surgery with the help of did they say Medicaid? Medicaid. So
Medicaid.
Yeah, tell me about that.
Medicaid does cover bariatric surgery, though Dr. Kim no longer takes Medicaid.
Okay.
So what I do tell the patients that call that have Medicaid is to call Medicaid, find out what bariatric surgeon in Florida covers that, because it will cover it almost in full.
Wow.
Which is good to know for them. We did take Medicaid a few years back, and we had some problems with getting patients follow-ups at other other doctors, cardiologist or a gastrointestinal doctor, and we would look all over, and finally we'd find someone that would take Medicaid, but then it would be months till they could get in, and we were just doing a disservice to the patients because we could not do full care of them. So Dr. Kim and the practice management decided not to accept it any longer, but I know it does cover weight loss surgery.
So there are doctors out there that do that.
I
and
am
people
thinking
can
that there are, yes, and that's what I will
do the
direct the
research.
people to do.
Yeah.
Call Medicaid, find out which bariatric surgeon in their area will take Medicaid for the surgery.
Okay, great. You were talking about the variety of different types of surgery. I'm sure patients, and one of the questions that we have here in the top 10, am I a candidate for surgery?
Definitely.
And not even knowing which one to choose, but how do people decide if bariatric surgery is right for them?
Okay. There are actual guidelines by the National Institute of Health that we have to follow because we are a center of excellence, and they lay out the groundwork for what the requirements are. So there's a thing called a BMI, a body mass index, and if you do go to our Celebration Bariatric website, there's a BMI calculator, because to do it by hand will take forever. But it actually goes over height and weight, and it does a little formula, and it gives you a number. The BMI will have to be 40 or greater if the patient will qualify for surgery. If the patient has a 35 or greater, it still will cover if they have a health condition that's associated with morbid obesity, which is called a comorbid condition.
Okay.
Those are high blood pressure, high cholesterol, diabetes, and sleep apnea. So if they are below a 35, bariatric surgery is not an option. And we frequently have people, 150 pounds, 160 pounds, coming to us and saying, oh, I want bariatric surgery for those 20 or 30 pounds, and they do not qualify.
Right. Right.
So that is one thing. There's also the FDA just approved a procedure. It is a gastric band done by the Lap Band company, and they approved it for a BMI of 30 to 35, which is something very, very new and exciting, and you have to have a health condition related to morbid obesity, but it is only a self-pay procedure.
Okay.
So they would have to come in and, you know, see Dr. Kim and everything, but pay cash for the procedure, and he would only put in that lap band because that is the new FDA-approved procedure for that weight group.
And certainly there's a lot of talk and discussion and research happening out in the scientific community about what is the right BMI for bariatric surgery. And the trend seems to be that the number continues to get a little bit lower, and we're kind of seeing that with this FDA recent approval.
It is getting a little bit lower because they are seeing the health benefits. We were talking about the diabetes, but also, after weight loss surgery, high blood pressure goes away. Half of the patients that leave our hospital are off their half of the medications that they were on when they came in a few days before. It can get rid of 90% of sleep apnea, which is a terrible disease related to morbid obesity where you cannot breathe well at night and you stop breathing.
Right.
So 90% of those patients, after they lose their weight, have no more sleep apnea. It can get rid of high cholesterol. Even you're off your medication, your cholesterol numbers are beautiful, and it can help prevent some cancers. There are cancers related to morbid obesity that the patient is at higher risk for just because they're obese. So there are so many health benefits. I think that is where the community is going. So if they can prevent the patient from getting severely morbidly obese and get rid of some of these health problems, the patient will have a longer life.
Yeah, fantastic. I want to just let everyone know, if you have a question, now would be a great time to ask it. We do just have Sharon here with us for a couple of more minutes. We're talking about bariatric surgery and if it's right for you. Sharon is the bariatric surgery clinical care coordinator at Florida Hospital Celebration Health. Say that 5 times fast.
I know, it's hard.
And we've been going through some of the top 10 questions that people have about bariatric surgery and the patients that you come in contact with on a daily basis. some questions, and we talked a little bit about this earlier on, but didn't touch on it specifically. Follow-up visits, coming into the office after surgery. We talked about how they're very important. You got to track people after this. This is not something that you have your procedure and then you don't have to go back in. It is pretty rigorous.
It is, and you would not be a good physician or a good program if you did not require your patients to come back. And our follow-ups at 2 weeks post-op, they're coming in to not only talk about the diet, to talk about how they're feeling, but also to check their incisions to make sure everything is healing well. Then they have an appointment at 1 month after surgery, 3 months after surgery, 6 months after surgery, and a year. And those follow-ups are for the sleeve and the gastric bypass. The gastric band is coming every 6 weeks for the first year. So it is very, very important. There is actual data out there that suggests that the patients that do not follow up do not do as well with their weight loss, and they gain their weight back quicker.
Wow.
So we tried to have them come back for their follow-ups, but we also tried to get them involved in support group. We have a beginning the journey support group, a general support group, a special one for just gastric band patients, 1.5 year and out, continuing the journey. And we have a cooking class. We have so many different things that patients can get involved in, and that is key to make that community with other bariatric patients and to make these lifelong friendships and have that support.
Wow. And it's certainly something to consider when you're shopping around for the right surgeon. And it's not just the doctor, it's what the program is about that people need to ask questions about.
It is very true. And Dr. Kim always tells patients, I do the very smallest part of this whole journey for you. I do the surgery. They have to do the follow-up. We have to supply the support, and I have a cell phone that my patient emails come to. So nights and weekends, I answer those questions for the patients, and I always say, don't, email me, I'm having a heart attack. But if they have vitamin questions, if they have nutrition questions, if they have a support problem at home with a family member, they are always emailing me, and I try and email back the same day. So I try to be a constant support for them besides the program too. But we have a bariatric dietitian, a bariatric psychologist, a bariatric social worker. We have so many people that could help whatever need they might have.
That's fantastic. Anything else in the last minute or so that you wanted to bring up that maybe we didn't touch on? I know there was one question on here about vitamins. Maybe we touch real quickly on that and wrap things up.
Okay. You will require vitamins for the rest of your life, and it is not because we're such a terrible program or bad surgery. It's because you're eating such a small amount of food. You cannot get all the vitamins and minerals in that you need. The gastric bypass patient does have a problem absorbing vitamins properly, so they are extremely important to take their vitamins the way that we ask them to do it. But we go over all that. They get a vitamin nutrition sheet, and we take care of that. And one last thing I want to I never gave you this question, but we have patients that come to us of all ages. Dr. Kim does not have an age limit for what patient he takes. We had someone come in 80 years old the other day for a consultation, and she was a healthy, vigorous 80-year-old, and he said, that is fine, you can have surgery. So that is good, and he has no weight limit. We do not discriminate. There are surgeons that won't take anyone over 300 pounds. We do. He wants to help everyone.
Yeah. So obviously there is a minimum.
There is a minimum,
but not a maximum.
18 years old and over. We do not have children at Florida Hospital Celebration, but 18 to question mark he takes care of.
Fantastic. Well, we've gotten a lot of great information about bariatric surgery from Sharon Kryzanowski, and of course we need to wrap up, be honest and be thoughtful of everyone's time here, but with the Healthy 100 expert chat. Of course, I want to thank Sharon so much for her time and her expertise on bariatric surgery. I know I certainly learned a lot from your top 10 questions that we went through here today. And of course, if you would like to make an appointment or learn a little bit more about bariatric surgery, you can do that. There's a phone number that you could call to schedule an appointment at Celebration Health. That number is really simple to remember. It's 407-303-DOCS. There are folks there that are ready to take your call. Also, if you'd like some more information, I know Sharon mentioned this very early on in our chat. Every Wednesday at 6 o'clock in the evening at Florida Hospital Celebration Health, Sharon hosts a free bariatric surgery information session. So you can bring your questions and get some information about that at that time. time. This is every Wednesday at 6 o'clock at Florida Hospital Celebration Health. And of course, you can get more information there on their website as well and get some details on that. So thank you so much for your participation in today's web chat. We really appreciate the questions that we got, and we hope we've provided some information that's helpful to you. This web chat is happening live, but it also is being recorded, and we're going to post it on Florida Hospital's social networking sites on Facebook and on Twitter. So if you wanted to share this information with someone else at a later date, we'll have that available for you. And of course, if you like these topics and you want to give some input on what next topic we're going to talk about, we'd love to have your feedback. You can learn more about these web chats by liking Florida Hospital on Facebook and following us on Twitter. We'll be sure and give you all kinds of updates on what's coming up next, and we'd love your feedback as well. Thanks so much for joining us this afternoon.